10 o'clock news. Fox 23 News at 10 starts right now.
So as we age, plaque builds up in the arteries, blocking blood flow to the heart. Doctors perform more than 1 million angioplasties in the U.S. every year to unclog the problem. And as you're about to see, what was once a complicated procedure is now much simpler as doctors reach through the heart through the wrist. Robert Santopietro looks and feels like a healthy 46-year-old.
I started working out, like getting back into shape, New Year's resolution.
So when he ran out of breath and felt chest pains during workouts, he brushed it off.
I just put it off to... I ate before I went to go work out.
The pain persisted. Robert had atherosclerosis. Plaque was building up in his arteries.
That plaque may become restrictive enough that there's inadequate flow, or more emergently, some degree of clot may form. This part that's much narrower here is the diseased part.
Robert needed an angioplasty to unclog his arteries. Instead of the traditional technique where doctors reach the heart by inserting a catheter through the femoral artery in the leg, Robert had a wrist angioplasty. Doctors thread a tiny balloon through the catheter and guide it into the blockage.
This is the area that was narrowed, that now has a stent.
In a leg angioplasty, there is up to a 10% risk of heavy bleeding. One study shows the wrist procedure cuts that risk by 60%.
When you're done, you pull the tube out and put a bandage on the wrist, and they can return to normal function very quickly.
Robert's stepfather, Dan, had the procedure done less than a week ago.
Before, I'd get halfway up the stairs and have to stop, and now I can go all the way.
Robert is also noticing a difference.
I feel 100% better. Knowing what could have happened and didn't happen is just amazing. I mean, who knows?
Now, another benefit, unlike angioplasty through the leg, patients who have the wrist angioplasty don't have to lie flat on their backs for several hours afterwards. And that's tonight's Health Alert. John?